Hi, I'm Julia. I'm a physiotherapist and I'm also a trained lymphedema therapist. The purpose of the film that we've put together is to provide you and your family with a visual guide on performing the techniques that we know are going to help you manage your lymphedema. We go through some techniques like deep breathing, exercise, massage, compression and elevation that we hope you'll be able to implement in your daily life to basically become an expert in monitoring your own swelling and any signs or symptoms that you might need to get some extra help with what you're doing. Essentially, lymphedema is swelling of your tissues that occurs after damage to the lymphatic system, most commonly from things like cancer treatments, like radiation or surgery. And in terms of thinking about lymphedema, one of the easiest ways to think about it is to consider the lymphatic system as something like the road system. So what we would usually talk about is that a lymph node that you have in your body is probably does the job of something like a roundabout at a busy intersection. And essentially things like surgery or radiation go and damage or remove this lymph node. So remove this roundabout from this really busy traffic intersection. And you can imagine yourself what we see, and it really is this idea of this build-up of traffic that occurs at that point where we've had the damage occur in the system. So the earliest signs of secondary lymphedema actually occur a long time before we see any visible sign of swelling. So what we're looking for are really sort of subjective kind of feelings. So lots of people describe they have a feeling of increased fullness throughout their armpit region, if we're talking about damage to the lymphatic systems in your armpit. Other people talk about feelings of fullness or heaviness through the groin when damage to the lymphatic system in the groins occurred. Lymphedema is a chronic condition. There's no cure for it at this stage, but we know that the earlier that you start managing the symptoms that you're having, the better the outcomes are going to be. So using the tools that we're going to go through in terms of exercise, elevation, massage, compression, these things are going to really make a difference in terms of minimising the amount of swelling that you'll ever have to deal with.
I got melanoma and had to be operated on. A week after I was told that it was definitely melanoma, I had to go into hospital and was operated on three Wednesdays in a row, and I had all my lymphatic system extensively taken out, not just the groin but right up to the vena cava. So I was extensively cut, and I believe that if you regularly do it, I don't have any issues whatsoever with the lymphedema. When I do, I go and visit my lymphedema physio, and she first of all measures it, and we have probably a few years of measurements on my leg, so I know exactly what part of my leg is meant to be at what size, but I can feel it first, and we move through that, and if I've got any pitting, she'll massage those areas where the pitting might be.
It's really important to become the expert in your own limb. So whether it's your arm or your leg, you are the person that understands more than anyone else the symptoms that you're feeling. What we try and encourage is to pay close attention to anything that your body seems to be telling you.